This is the way that pain management needs to be done across the country.
This is what needs to happen to healthcare.
The goal is for us to change healthcare in a way that it hasn't yet been changed.
I got into chiropractic at a young age. I actually come from a family of chiropractors. I'm one of 12 in the family, so there's a lot of them. So I actually grew up around chiropractic before going to chiropractic school.
I've been working in healthcare and hospitals since I was 14 years old. My dad was a physician. My brothers are physicians. It's kind of like the family business.
I started off my career as an anesthesiologist, did anesthesia for about 13 or so years. In that process, I was working with one of my other partners in the practice, Dr. Eric Church.
I started to notice that patients that were getting rehabilitation care plus injections got better outcomes.
At the time, Dr. Thompson had 3 medically integrated chiropractic clinics. Once Dr. Church and I kind of became involved, then we became a lot more surgically integrated as well.
When I met Dr. Church and Dr. Moshiri, we were able to bring in the high-level interventional pain and minimally invasive surgery procedures and really begin to say everything from injury through recovery, we were going to be able to help those patients get an answer that was non-pharmacological. They didn't have to get on opioids to get relief, and instead we were going to get to the root cause, find out what's happening, and then as a team of providers, we were going to collaborate to get you back to doing the things that you love, all pain-free.
And it became apparent that really this is the way that pain management needs to be done across the country.
The goal is for us to change healthcare in a way that it hasn't yet been changed.
What we're doing is disruptive. What we're doing today is competing with what has been the de facto standard for managing pain for decades.
When you have different specialties actually talking to each other and communicating about how they're going to help the patient, that's where you see healthcare really happen. And unfortunately, that does not happen a lot in healthcare around the country.
It seems to be very fragmented.
Healthcare is kind of like fragmented. You go see one doctor for physical therapy, you go see another doctor for medications, you see another doctor for injections, and we decided that a better model would be to have it all under one roof.
This is what needs to happen to healthcare. If we're going to conquer an opioid epidemic and get people off meds that are unnecessary, get them away from addicting things that they don't need, one of the most important things is to get doctors to start communicating.
And at that point, we needed to have the operational methods and platforms and technologies put together to enable the company to grow into a much bigger size than what it was capable of doing.
And since then, we've grown really rapidly. And I think the biggest reason that we've grown isn't because of, we have a superstar doctor or anything like that. But in reality, it's because we're doing what people want, which is treating the root cause.
Now we've established the company as you see it today. We have multiple locations, both here in Arizona and in other states. And the idea behind the company really is to provide more of a well-rounded care for patients that have symptoms, pain conditions from various etiologies. And we do that by providing both physical therapy, rehab, chiropractics, and interventional pain all under one roof.
We continue to expand and try to help as many patients because our ideal is to conquer the opioid epidemic. And we know that the way we can do that is through building this network where providers put the patient at the center of care.